Good evening, everyone. How are you going? David Johnson here from the Back Pain and Functional Movement Training Centre. Quick video. As you know, most of my practice focuses around helping people with spine-related pain, spine surgery if we need it, but of course, most people want to avoid spine surgery. The longer you put up with your back pain-related symptoms, the closer you are moving towards needing a structural intervention as well as the functional intervention to treat your back pain. If you see me early, if you get good advice early, then all you really need is a functional intervention, because back pain is primarily a functional disease of bending and poor biomechanics. That is what causes back pain, and we call that movement dysfunction. And the quicker you eliminate your movement dysfunction, the quicker you can get on with your quality of life, your employment, your sports and leisure, and not fall into the trap of needing lots and lots of pain medications, pain procedures, cortisones, all the rest of it, and eliminate symptom-based interventions. But you must apply a cause-based intervention. We use functional movement as our weapon, as our tool, as our therapeutic modality to treat movement dysfunction. Functional movements need to be expressed in a proficient way, a biomechanically proficient way. There's no point expressing functional movements in a dysfunctional way. Just like there's no point driving your car badly, because you're more likely to have an accident. But when we use the term functional movement, it's very clear to me that a lot of our patients have never even conceptualized, and therefore that means that the people who are providing them with advice have never talked to them about what functional movement is. And so I thought, given the fact that this is our primary functional tool to improve the lumbar spine or musculoskeletal system, let's define what functional movement is. Okay, it's really important because we need to contrast it from artistic movement or monostructural movement. Artistic movement doesn't really have any rules. That's what makes it artistic. And you can do whatever you like, and someone can say that's wonderful, that's a wonderful dance, or it's subjective. Monostructural movements means we're just doing the same thing all the time, like running, swimming, walking. It's monostructural. Functional movement is distinctively different, and that's why we use the elements that or the characteristics of functional movement as our therapeutic tool. No different to taking a medication or a tablet, say an antibiotic. It's very important that we understand what that antibiotic does and why it does what it does to kill the pneumonia or whatever it may be that you're trying to treat with that therapeutic tool. So why do we want to express functional movement? Well, it has a very powerful effect on the musculoskeletal system, physically on the joints, and also physiologically on our neurohormonal system, and that's important. Functional movements afford us the greatest functional capacity, and functional capacity just means that we can do most work, okay, and we can express the most energy. Energy is simply the ability to do work, and it also means that we have the ability to do work at the greatest rate, which is termed power, because work is mathematically calculated by this formula of force times distance. Okay, so if I move something that has a load, there is that object expresses a force against me. So say I'm lifting something up, 10 kilograms, for example. 10 kilograms has a gravitational acceleration, which is in newtons force. And if I lift that 10 kilogram weight off the ground, then I'm moving at, say, 1 meter. I've expressed a certain amount of work. If I move that 10 kilogram object off the ground 1 meter twice as quickly, then I've expressed it in a quicker time domain, which means I've expressed double the power. And functional movements allow for the greatest expression of work and power. And that's important. You'll understand why in a second. What are the characteristics of functional movement? They are natural, okay? Babies go through their milestones. They start lying on their tummy, they start crawling, they start to get onto their knees, and then they start to walk, and then they start to play with their toys, and they will squat down, expressing beautiful functional movement without even having attended one lecture, one course, one book. It's hardwired in their DNA to move naturally and with functional movement. Okay, that tells us one thing already, that that's the way our body's meant to move. When we go to non-industrialized countries, societies, cultures, we see much more preservation of functional movement and much more preservation of biomechanical movement proficiency. When we come into urbanized, rural, non-industrial, non-rural societies such as office buildings, we've done the research, 90% of people have corrupted movement, 90% of movement is not expressed in a functional manner, and movement dysfunction is very, very prevalent, which is reflective of increased musculoskeletal disease in industrialized cultures. It's multi-joint, which means we're moving lots of joints. Another word for that is compound, and means that we're using more muscles, and our range of motion is far greater when we're expressing functional movement. That's a characteristic. The kinetic chain, so the musculo-ligamentous kinetic chain is activated centrally to peripherally, or from our core to our extremity. Think about that as being like a whip cracking. Okay, the movement of the whip starts in the handle. The movement is slow in the beginning, and as the kinetic chain extends down the rope, the acceleration increases, or the velocity increases. And that is the same as when we're expressing functional movement. So I'm picking something up. The movement should start from my core, and as I move, the kinetic chain of musculo-ligamentous activity moves from core to extremity, and also you notice that the velocity of movement moves from core to extremity, from slow to fast. Another characteristic. So inherently powerful, we've also already touched on that to a degree. Functional movements allow us to move the largest loads, the furthest distance. We can move them quickly, repetitively, and for the greater duration. The expression of power results in intensity, okay? We just talked about the ability to do work and the ability to do work quickly, which is more powerful. That is defined by the term intensity. If I run up a flight of stairs, 10 stairs, versus walk up slowly, I'm going to feel very, very different between going up the stairs slowly and going up the stairs fast. I've done the same amount of work because it's force times distance, but if I express that force times distance much more quickly, I will feel intensity, and my heart rate will go up. I might start sweating, I might start panting, because I've expressed intensity. And functional movements allow the expression of intensity, and that's really important, because when I have that intensity as a physiological stimulus, my neurohormonal secretion, brain-derived neurotrophic factor, growth hormone, dopamine, serotonin, adrenaline, IGF-1, cortisol, all of these hormones are measurably different in a human being who expresses functional movement versus a human being not expressing functional movement. Okay, that is undeniable. So those hormones result in a physiological favourable adaptation. And that basically means that you're healing, okay? You're healing, you're getting better, your nervous system is getting better. The structural elements that make up your spine and musculoskeletal system are being allowed to heal. We're promoting the natural recovery. Okay, so that's the summary there of what characterises a functional movement. But we also need to express functional movement in a proficient way. Okay, it's not good enough to just say, oh, well, these are the characteristics of functional movement, but I'll express them with poor biomechanics. That's not going to help. Like if I have a motor vehicle, there's my motor vehicle, there's the elements that make up or define a motor vehicle, but now I'm going to drive it really badly. Okay, that's not a good, that's going to result in a system failure. So we have our fantastic movement characteristics, and now we express them biomechanically proficiently. And in regards to the lumbo-pelvic spine, back pain, NeuroHab is our program that defines proficient functional movement for bending the torso, because back pain is primarily a functional disease. It's a functional disease of poor bending. That's where our back is most susceptible. And so therefore, if we express functional movement and if we express it correctly with these biomechanical characteristics, then we've eliminated or we've mitigated that biomechanical bending disease. Hip-centric rotation, of course, we have a ball and socket joint here. Naturally, that is empirically a movement that we should capitalise on. We want hip-centric rotation as opposed to lumbar-centric rotation. Intra-lumbar flexion is very dysfunctional. Let's keep the spine in a neutral position and utilise our hip-centric rotation as the point of torso inclination. Okay, incline our torso from the hips to do our bending tasks, which we will do about 5,000 times a day. Trivial, physically demanding 5,000 bends per day. Neutral spine maintenance means that we are going to start to activate our multifidus muscle. Our multifidus muscle is critically important. I'll show you a quick model here. The multifidus muscle sits here, small finger-like muscles that are deep and close to the spine. They're like the cross-bracing of your spinal joints, and those muscles are critically important to maintain in a healthy state so that they can grip and create that intersegmental stability around the lumbar motion segments, okay? The multifidus muscle. And so the neutral spine position activates that muscle maximally as we incline into that hinging position. Posterior kinetic chain powered movement, that means I'm activating the hamstrings, I'm activating the glutes, I'm activating all of the general stabilizers, the intersegmental stabilizers, and the mobilizers of my torso and my lumbar spine, and that's called posterior kinetic chain powered movement. Unloaded knees is integrated into that. I do not want to load my knees, because when I load my knees, as in the current workplace health and safety guidelines, which just say bend your knees and keep your back straight, terrible. When I bend my knees and keep my back straight, I'm almost breaking all of the rules other than hip-centric rotation. I'm breaking the rules because I'm now going to drop into a deactivated intralumbar flexed position, which of course it's not a functional movement and it's dysfunctional movement. So I'm going to create a lot more biomechanical stress on my joints and promote accelerated structural change, which we can call degeneritis. And that means painful degeneration as opposed to normal pain-free age-related degeneration, which is normal as opposed to pathological when it's accelerated. So unloaded knee positions. And then the last point, proficiency, limited intensity. That means we have to regress people's movements, especially when they have a lot of pain and disability. We have to regress the elements of functional movement, and we have to regress the movement points of proficiency so that no rules are broken. Okay, so for someone just bending over to pick up a water bottle off a bench, maybe that they would break those rules if they had to do that task because they have so much pain and disability. So in that circumstance, we have to say, look, you have to have things at an elevated position so that your range of motion can be limited so that you don't break any of those rules. You're still going to do a functional movement. You're still going to apply these rules, but you've regressed the intensity element and it may be range of motion. As they maintain that that regression, their musculoskeletal system is starting to get a little bit healthier. So now we can start to increase the range of motion. Okay, so the range of motion, oh wow, a month later they can go a little bit deeper with their range of motion, and then as that gets better, the musculoskeletal system gets healthier, so now we can start increasing repetitions. So the intensity can increase, we start increasing repetitions, we start increasing load, we start increasing speed, we start increasing duration of repetition. So the intensity is ultimately modifiable so that we don't break any of the rules of functional movement and biomechanical proficiency. That's what that last statement is. Functional movements allow us to recover from injury, okay, because we're seeing people who have injuries, whether it's macro injuries, falling downstairs, or whether it's accumulative micro injuries that end up, the end result is the same, pain and disability. We want to recover from those injuries. We want to prevent future injuries, because what's the point of recovering from one injury, then a month later you've got another injury, okay? Imagine you're a furniture removalist, imagine you're a labourer. You've just recovered from your L5S1 injury, you're back to work and then you get another injury, okay? That's what understanding functional movements and movement proficiency allows us to do. It prevents further injuries down the track. You'll never have to see us again. You never have to see your chiro again. You never have to see your massage therapist. You never have to have another acupuncture, cortisone. You never need to buy pain drugs again. We prevent future injuries, we recover from our injuries, and we restore functional capacity. Because not only do you need to recover from your injury that obviously caused your functional capacity to drop into its boots, your employer is not going to be happy or you're not going to be happy until you've restored your quality of life. And that means we've got to restore your functional capacity on the foundations of movement proficiency and functional movements. Let's talk a little bit about stability and what how that relates to functional movement. Stability of a joint is the ultimate requirement. Okay, that is the ultimate requirement for joint health. Stability is therefore the ultimate pursuit for all musculoskeletal rehabilitation methodologies, programs, schemes, organisations. But it's incredible how much that is ignored. Even in the national guidelines for back pain rehabilitation, they don't use one sentence, they don't have one sentence dedicated to joint stability. And functional movement therapy, functional movements, movement proficiency has the primary goal of restoring stability to the lumbar motion segments. You do not obtain stability simply by getting stronger and stretching. Okay, you have to upskill movement proficiency. That is a characteristic of a functional therapy. You are getting more skillful. When you lie on a couch, when you receive a massage, a chiropractic manipulation, or a session of dry needling or acupuncture or deep tissue release, you get off the couch and you are no better skilled. Okay, when you do functional movement therapy, every time you walk away from the studio, the rehabilitation centre, you're walking out with a new skill that you have to practice and integrate into your motor patterns. Okay, so upskilling is absolutely essential, and that's also been very clearly described by Panjabi, a researcher back in the 90s. He talked about the neural control subsystem that defines stability of the lumbar motion segment. Neural control. Functional movement offers the greatest functional capacity. We talked about functional capacity being critically important because functional capacity is directly related to stability. Okay, so that's the ultimate pursuit. So we have to have a functional capacity that meets the necessary stability for our joints and our lifestyle, which is functional demand. Our lifestyle is our functional demands. Are we a labourer? Are we a teacher? Are we a butcher? Are we an office worker? Those are the functional demands. And on the weekends, do we want to go motorbike riding or do we want to go surfing? Those are the functional demands. Functional capacity is directly related to stability, and functional demand is inversely related to stability. If I reduce all my functional demands, I can remain stable, okay? So that means if I don't do anything, I can remain stable and I can circumvent or mitigate pain and disability because I'm stable, but it means I can't do anything, okay? The extreme example of that would be if I fell off my motorbike, I sustained a teardrop fracture, hangman's fracture, burst fracture of my neck. That's highly structurally unstable. How do I maintain stability so I don't become a wheelchair-bound quadriplegic? I just lie there on a spine board, dead still, have someone hold my neck and cart me off the road into an ambulance and go into the operating theatre to have some titanium put in my neck to restore stability. But in the interval period, before I get that titanium in my neck, the functional demands are almost zero. I'm just lying there to maintain stability. Okay, and the opposite is true. If I have a very high functional capacity, then I have a robust spine, I might fall down some stairs, and as long as all of my musculature and my joint integrity is pretty good, I can stabilize my body, and as I'm rolling down the stairs, my multifidus is acting, I'm creating this suit of armor around my spinal joints, and I have an injury, so to speak, an accident, and I still remain stable. Okay, so those are the two extremes, but it is fundamentally and empirically undeniable that these are all relevant and a part of the clinical understanding of managing back pain. We have to try to maintain the high functional capacity, and we have to maintain stability, and functional movements allow us to do that. So, take-home message, a musculoskeletal system must have a functional capacity exceeding our own lifestyle, individual, personal, functional demands, and we build functional capacity to maintain stability, and we create that on a foundation of the default expression of functional movement proficiency. I've defined functional movement for you. I've defined movement proficiency for you. And I've used this word default. It doesn't mean that sometimes I'm not going to do artistic movements, okay? It doesn't mean that sometimes I'm not going to throw my arms around in a dysfunctional way, or go to a rave party, or do some dancing that's artistic, or observe a ballerina that would be considered artistic. It doesn't mean I can't go for a monostructural swim and just do the same thing over and over again. But my default movement for activities of daily living that involve bending and lifting and doing things that I have to do as a human being, walking on 2 feet, walking on 2 legs, I'm bipedal, I'm going to be doing everything in front of me. Not everything is at chest height. Most of our movement tasks require some form of bending. If my default expression of those movements is proficient functional movement, I'll have a healthy, robust spine, and I will be able to get away with the 10% of movements that are not functional and that may not be done with biomechanical proficiency. And that will protect me throughout life. I will then have normal age-related degeneration, which is pain-free. Okay, make sure you understand that it's a normal degeneration is pain-free. Accelerated degeneration, which we should then call degeneritis, is painful and pathological, and it comes about as a consequence of not expressing functional movement proficiency. All right, quick video, done. See you next time. Thanks for listening.
You're like my kryptonite, got me